Basics. What is blood pressure? The pressure that your blood exerts against your arteries as it is pumped through your body by the heart. The pressure in the arteries increases when the heart beats and decreases while it is resting. Measuring blood pressure. The sphygmomanometer. The sphygmomanometer is also called a blood pressure cuff. Pump. Inflates the cuff to stop blood flow. Dial. Used to read blood pressure. Valve. Lets air out of the cuff, allowing it to deflate. Cuff. Used to temporarily stop blood flow. Measuring blood pressure. The stethoscope. A stethoscope allows you to hear your heartbeat and your blood flow. When used with a sphygmomanometer, you can hear the blood flow through your brachial artery, allowing you to measure your blood pressure. Measuring blood pressure. Procedure. Sit comfortably with arms supported at heart level. Snugly wrap the sphygmomanometer cuff around the upper arm, 1 inch above the elbow. Place the stethoscope just above the crease of the elbow. Pump the cuff to around 180 to 200 mm of mercury. While listening with the stethoscope, slowly open the valve to let the pressure fall. When you first hear the beat of the blood flow, that is the systolic pressure. When you last hear the beat of the blood flow, that is the diastolic pressure.
Manual or aneroid equipment includes a cuff, an attached pump, a stethoscope, and a gauge. This equipment requires coordination. It's difficult to use if you're hearing or visually impaired, or if you're unable to perform the hand movements needed to squeeze the bulb and inflate the cuff. When you're ready to take your blood pressure, sit quietly for 3 to 5 minutes beforehand. To begin, place the cuff on your bare upper arm 1 inch above the bend of your elbow. Pull the end of the cuff so that it's evenly tight around your arm. You should place it tight enough so that you can only slip 2 fingertips under the top edge of the cuff. Make sure your skin doesn't pinch when the cuff inflates. Once the cuff is on, place the disc of the stethoscope face down under the cuff, just to the inner side of your upper arm. Next, place the stethoscope earpieces in your ears, with the earpieces facing forward, pointing toward the tip of your nose. Rest the gauge in the open palm of the hand of your cuffed arm so that you can clearly see it. Then, squeeze the pump rapidly with your opposite hand until the gauge reads 30 points above your usual systolic pressure. Stop squeezing. Turn the knob on the pump toward you to let the air out slowly. Let the pressure fall 2 millimeters or lines on the dial per second while listening for your heart sounds. Note the reading when you first hear a heartbeat. This is your systolic pressure. Note when you no longer hear the beating sounds. This is your diastolic pressure. Rest quietly and wait about 1 to 2 minutes before taking another measurement. Record your numbers either by writing the information down or by entering the information into an electronic personal health record.
Reading blood pressure. Blood pressure is measured in Hg and given as a fraction 120/80. Systolic pressure in the arteries while the heart beats. Diastolic pressure in the arteries while the heart rests. Variations in blood pressure. Abnormally high blood pressure is called hypertension. Any blood pressure reading greater than 140/90 is considered high. Hypertension is usually asymptomatic. Abnormally low blood pressure is called hypotension. There is not a specific blood pressure value that is considered low. Symptoms define whether blood pressure is too low. Dizziness, blurred vision, nausea, fatigue,